I had hip surgery in May of 2010. The reason I picked Durham Regional is because it is a smaller hospital, and I did feel, on the whole, that my being an advocate for myself was very well received.
To prepare a patient for orthopedic surgery, we actually begin right when the surgery is scheduled. We involve all the physicians, and the patients do fill out a discharge planning guide, which helps us start to prepare for where they're going to go for their recovery before they've even stepped foot in the hospital. We've developed a very exciting program. We call it the Forward Motion Program, which is rather aptly named. One of the best pieces of the program, though, is our orthopedic joint replacement class that we hold preoperatively. It gives the patient an opportunity to talk to physical therapy, occupational therapy, discharge planning, and nursing. They get to take a look at all the equipment that they're going to see and actually handle it, see how it's used.
So I came here, and it helped me because I liked being in the room with other people who were going to be having surgery. There's just that sense of community. I spoke with the nurse afterwards. I went up to her and I said, I have some concerns, I'm chemically sensitive. She said, come into my office with me. And we went to the office, and she must have spent a good half hour with me, and she printed out information about certain drugs that I would be taking after the surgery and that may be given to me during the surgery. And I was so impressed by her presence with me and being concerned about hearing my concerns.
Really, our success as an organization and the success of us in our ability to achieve our vision of being the best community hospital in North Carolina, achieving our strategic plan, really rests on our values and living those values every day. It rests on our ability to provide the best care for our patients, for their loved ones, and really for each other, because the more we support each other, the better care we can provide to our patients and their loved ones. And that means that we go the extra mile. So we try to learn about our patients and learn what is unique to them and how we can provide for them.
Chemical cleaners really do me in. So I mentioned that to Pat, and she was on it. She said, oh, I'm so glad you told me that. So there was a sign outside my door. It said, no cleaning. So they took care of it appropriately like a day before, and I don't know that every hospital would be attentive to that, so I really appreciated that. I mean, it was so many things I could check off my list. I don't have to worry about this, I don't have to worry about this, I don't have to worry about this. They care about the fact that I'm taking care of myself.
Everybody that is within the confines of DRH does touch our forward motion patients. I mean, everybody is key. Everybody plays such an important role, and I hope they realize that. Because every person, every time, for every patient, that makes all the difference.
Even from the moment I started the pre-ops, before the surgery, almost everybody that I encountered was personable with me. And I think it's also a matter of being personable oneself, and the interaction I had with people, I wanted to make a real connection with them and acknowledge them in their work, which I think it's a two-way street, really, to me. And it's all a collaboration. I saw everybody as part of my team that I interacted with, and it just made a huge difference for me in coming to Durham Regional and getting myself prepared for that. It really amped down any concerns or stress I might have been feeling.